Welcome back to our Mental Health Matters show. We're doing part two of getting vaccinated. I have Dr. Abshai on the show, and he is going to wrap up with talking about the different types of vaccines for COVID-19, and also just giving his personal recipe that he have, and also just giving us more education about how to combat COVID-19 with getting vaccinated. So get you something to drink, get you a snack, and come on back. Okay, welcome back to the show, Dr. Abshaya. Once again, thank you for just being a guest and just kind of talking about the pandemic and everything that's surrounding COVID-19, because we sure need it during this time. So let's just jump right into it. When we took a break, you talked a little bit about you have a personal recipe if you got COVID-19. So talk a little bit about that.
Right. I encourage patients to do nasal saline flushes. What I'm talking about, and some of your patients or some of your viewers may already know, but it's saltwater flushes in the nose.
Really?
They're not real fun to do. It's not something we want to see you do, and it's not something to do in public, but it is a good thing to do. So there's different ways of doing it. So there's something out there called a neti pot, N-E-T-I, neti pot, which looks like a little tea kettle that you fill up with warm water, and you pour a little salt packet in there. So there's a neti pot. There's something called sinus rinse, which is like a little squeeze bottle that's got 6 or 8 ounces of water in it that you squeeze up the nose. There's something that's been advertised on TV called Navage, N-A-V-A-G-E, Navage, and it's like a little box. Frankly, it looks a little medieval to me, but they hold this box up to their face, and it squirts water in one side of their nose and sucks water out the other side of the nose at the same time. So I've got patients that actually like that one. For people to get sick with COVID, you have to have a significant viral load. When we're talking about viral load, we're talking about number of viral particles. So if you were to get exposed to maybe just 1 or 2 viral particles, that's a low viral load. It wouldn't be enough to make you sick. In fact, it might be a good thing that just gives your body a chance to get immunity from it, kind of like getting a little mini vaccine in a way. But to really get sick, you have to have a big viral load, and the virus likes to hang out in the sinuses, as we know. And if you wash those sinuses out with salt water, you're going to cut the viral load. And you're going to do better.
Interesting.
I am a fan of these. And so if you're ever feeling sick for whatever reason, so that could be you've got springtime allergies, when the air quality was real bad here last year with all of the fires and the smoke and everything that was irritating. Or you get a sinus infection or head cold or the COVID virus itself. If you wash that out, whether it's pollens or smoke or dust or virus, you're washing that stuff out, and your body's going to do better because there's not going to be as much of that, whatever it is, bad stuff, virus, pollen, whatever, that's creating you to feel ill. So I am a fan of that. I'm a fan of vitamin D. D is in dog, and zinc and vitamin C.
I'm writing this down.
Yeah. So and actually for my patients when they get COVID, I actually tell them to take 1,000 milligrams of vitamin C, 50 milligrams of zinc, and high dose vitamin D. And that the vitamin D is a bit tricky. People can get too high on vitamin D. So I'm a little hesitant to put out a blanket recommendation for your viewers. So they may want to check with their own doctor on that. But
Yeah.
for myself, when I got it, my whole family got COVID. Incidentally, I didn't get COVID at work. I got COVID at my house. Because we had to have a bunch of workmen come into our house because we had a hot water heater break.
Yeah.
And messed up all the floors and everything. So we had a bunch of workmen come in. And at the time we didn't know it, but it turned out they all had COVID.
Wow.
So my wife, my son, and I all got COVID. But at the first signs, we started doing that, and we took high dose vitamin D. So some people are already taking vitamin D at pretty high doses, I know, out there. So I would probably tell them to leave their dose alone. We had not been taking any vitamin D at the time, so we started to take actually as much as 50,000 units of D a day for a week. And I wouldn't do it for over a week because, again, you can get too high on it. Anyhow, we were all feeling good in 24 to 48 hours.
Oh, wow.
And my wife lost her sense of smell. But I'm a person, I like to look at the positive side of things. And so that came in handy a little while later when our dog decided to go play with Mr. Skunk. And so when she lost her sense of smell, she could go and watch the dog up without having to smell the dog. So
yeah,
you try to look for the little small positive things in life when you can.
Yes, absolutely.
So, yeah. So again, I highly encourage people to do that. I think the nasal saline flush is really really key. To date, I've probably had over 100 patients that have had COVID, and fortunately, it hasn't killed any of them. And I think that there may be three reasons for that. One, I may just be lucky. Two, I pray for patients. And three, I encourage people to do these nasal saline flushes. So I think that's key. I've had some of my patients have been very high risk patients that have had COVID as well. So
yeah. That's good to know. I'm definitely gonna pass this information on to like my family and friends for sure. To do that. So that's really good to know. Any other advice that you could give with because this is helpful.
I think keeping a positive attitude. So before all of this COVID thing came up, I'm going to put in a cheap plug here. I wrote a book, and theme that runs through the book is attitude, focus, and perspective. So what I find is if you keep a positive attitude, you focus on your faith and look at things a little different perspective, a positive perspective, you'll do better with the situation that you're in. And before all of this COVID hit, I was going out and doing speaking engagements in front of groups of people at various places. And one of the things I really worked and emphasized on there was not only talking about my book, but I emphasize the physiologic benefits of humor, gratitude, and forgiveness.
Yes.
So in the last segment, I mentioned that fear and social isolation are bad things in terms of how our body is going to respond and how our health is. Humor, gratitude, and forgiveness are just the opposite. So they're tools we can use to make our bodies actually work better. So I actually keep a couple little reminders, because you really have to work at trying to keep a positive attitude.
Yes.
So I carry these little rocks around in my pocket that kind of rattle around there and occasionally wake me up and remind me. So one of those, I don't know if you can see it, but it says on there, attitude of gratitude.
Yeah. Oh yeah.
And so it kind of if you can be grateful for things, then you're going to be happier and do better. So for instance, when my wife lost her sense of smell, we found something to be grateful for, because she was able to wash the dog without smelling the skunk. So just little things like that, and it'll just make you happier and actually get a little more enjoyment out of life. And then the other little rock I carry around is one that says rejoice on it. And again, it's helping us to look at the positive for me. That's my faith in the Lord. But it also helps me to keep a positive attitude, being grateful for the good things that I have, and also look at things with a little positive perspective.
That's good. Thank you for that, because I think that definitely goes along to what we're talking about. And, all the gratitude can definitely be combated against all the negativity that's coming through the media, that's coming through, people living in fear, and just to be alive, and being able to survive this pandemic alone, we should have a heart of gratitude. So thank you for
Exactly.
that.
And I think that, that positive attitude, I think, really strengthened our immune system. And I think, my family at least was blessed in being able to fight the virus off.
Yeah, thank you for that. That's good.
Yeah.
That's good. Really, really good information. So let's switch a little bit to the herd immunity. This is the first time I've heard about it, which lets you know how much I've been really following the virus. So talk a little bit about the herd immunity.
Yeah. So what herd immunity is talking about is when you're talking about like a herd of animals. And I kind of hate to put the human population into the group of a herd of animals, but in reality, that's what the scientists that are studying it are looking at. So when you have a big group of people, and if a bunch of them have immunity, then it kind of blocks the way for the virus to go. One kind of analogy I can think about. So the virus is out there, so the virus, I've already conquered the virus, or my body has anyhow. And so right now I've been there, done that. I've had the virus. I'm confident of my immunity in the virus. And so the virus can't use me at this point to spread it to other people. So I'm one little barrier to the virus, but there's millions of other people out there that are still capable of spreading it around. It's kind of like if you're trying to get across town in a busy city and you put a roadblock up on one little tiny block of that, well, that's a little bit of a nuisance, but it can easily find its way around that one little roadblock. But let's suppose that you get enough people out there that have immunity, so there's enough barriers. So let's say you've got, instead of having one roadblock out there, you've got 50 or 100 roadblocks out there. Pretty soon it's hard for you to be able to travel across town at all because there's so many roadblocks in the way. And so the virus is not able to spread around because so many people already have immunity, and it can't use the people that it's in contact with to try to spread it to other people.
Wow, I've never heard of that.
Yeah. So the real question is at what point do we reach herd immunity?
Yeah.
And it's clearly over half the population. Okay.
Yeah.
And there's kind of debate out there. As far as this COVID's concerned, the true answer is we probably don't really know. But it might be when we're at 2/3, 80%, 90% of the population has immunity to the virus, either by already having the virus or having the vaccine, that it really blocks the virus from spreading around to us. We've got cases of past diseases that through vaccines that we've eradicated completely. Basically we had herd immunity to. One example might be measles. For much of my life, I'm old enough that when I was first born, measles existed and was common, was out there. And then we had the measles vaccine, and we had enough people vaccinated that basically we never saw a case of measles again. Up until just this last couple of years, we've had cases because people don't want to get their kids immunized. And so we've had some cases that I think it was publicized, like I think people got some in Disneyland or somewhere, that there were some cases of the measles, which we hadn't heard of really from years in the past. And it was because people had stopped immunizing their kids for it. And so some of the herd immunity was waning away. And so there were cases of it that kind of came back on us again.
Wow. Man, that's just so you know, it's very interesting because honestly, I didn't even know about herd immunity.
Right. So in a way, again, looking at I can kind of think of another reason to get vaccinated is you're trying to help your fellow man.
Right.
Because every time you get vaccinated or your friend gets vaccinated, that's another little roadblock or barrier that's keeping that virus from being successful, and one more step towards immunity. So not only are you helping yourself, but you're helping your brother and sister out there.
Yeah, absolutely, absolutely. So I'm curious to find out amongst your patients, what are the age group that you've seen who mostly had the COVID-19 to come see you, like the youth, older adults, or just middle? What is the primary age group?
Like I say, I've got patients all the way from 18 up to 100. And
Okay.
I had a whole broad spectrum of people. It's pretty mostly kind of shotgun out there through the crowd that I've seen that have had it.
Okay, so what about race? Would you say the same thing with race as well?
In my own population, again, I think it's pretty well represented throughout. I think there is some of the minority communities that have been more heavily affected. Some of that might be because where they're living, they're more in close contact with others. So that might be part of it. And some of them, unfortunately, may not have quite the access to getting the medical care. There's a question out there: is somebody from a certain race more susceptible to the virus than somebody from another race? I don't know the answer to that question necessarily. One thing I might mention is blood types. There's, people there. I've had a lot of people come in to me wanting to know their blood type because it looks like in one study that people with type A blood didn't do as well with COVID as people with type O blood. And so that looks like that may be a real thing. But the thing about that is that people with type O blood still get sick, and there's still plenty of people out there with type A blood that do fine with it. So the difference is not all that great. So when I have patients with type O and type A, I basically treat them the same because I think they're still at pretty good risk of getting sick from it. And when I see, I've got patients from all walks and races and creeds. Frankly, I treat all my patients the same. No matter who they are, where they're from, or what they look like. So.
Yeah. So people who, so how can I pose this question? So people who is diagnosed with COVID, is it best for them to get the vaccine while they have the virus, or wait until they're clear from the virus?
Yeah, good question. The CDC is recommending people that get COVID to get vaccinated 90 days after they had it.
Okay.
And they're saying that you can get vaccinated as soon as 14 days after you have it. If you get it 14 days after you have it, you may be more likely to have a stronger side effect reaction from it than if you wait the 90 days. Again, the question out there is at what point do the people that have had COVID, does their immunity wane or tend to go away? And bottom line, we don't really know the answer to that. Again, I think I mentioned an NIH study. It looks like people have immunity after the virus for about 8 months, at least, anyhow.
Okay.
And in terms of the vaccine, the immunity also will go away. How long does that last? We don't really know. And so at some point in the future, my guess is they'll recommend for people, whether they've had COVID or whether they've had the vaccine, to get a booster shot to kind of boost their immunity up. Kind of like what we do with the flu shot every year. We recommend people get another flu shot every year. And with the flu shot vaccine, they're always kind of tweaking the vaccine in terms of how it covers things. And quite likely the vaccine companies may do the same thing with COVID, because we are seeing some mutations with that as well.
Yeah. So do you feel like in the near future, since we are seeing mutations, do you feel like things can spiral back out of control, or you think because we now had a vaccine that we kind of got a hold of it?
I like to be positive. I think we've got a pretty good hold of it. It looks like the vaccines that we have are working pretty good against all of the mutations. Maybe not quite so well against the South African mutation, but looks like it's still working. And one thing I would say, for instance, the Johnson & Johnson vaccine, I mentioned you get about 2/3 immunity from that, which means there's about a 1/3 chance that you still get sick from it. But the real key with that is the number of severe illnesses, so hospitalizations and deaths, we don't see. So if you get the vaccine, you may still get sick, but you won't be deathly ill, basically.
Right.
My suspicion is that's probably what we're going to be seeing with these variants. We get the vaccine, we may have not complete immunity from it, but partial immunity. and hopefully enough immunity that it doesn't land us in the hospital or dead. So I am pretty hopeful that I think things can really move back towards normal.
Wow, I sit back and I think about how this virus has really shook up the world, and in your years of study or living, was there something or another virus in the past that was comparable to COVID-19?
Well, there's the bubonic plague
Yeah,
that we hear about back in the 1300s
yeah,
that wiped out, what was it, a third of Europe or something like that.
yeah,
And the the Spanish flu in 1918, I think killed 20 million people, more than all of World War. That was right after World War I.
yeah,
When that flu hit us, and it wiped out more people than all of World War I. So
yeah,
I think in terms of consequence on society, I think those two instances might have been greater. Certainly, I think the bubonic plague was probably worse than what we've been seeing with COVID. But certainly in my lifetime, COVID's been the worst.
yeah.
And
Okay.
particularly the social economic consequences of it have been extremely huge.
Okay.
Yeah.
All right, Dr. Abshire, thank you so much. And time just go back so quick when we're doing these shows.
Okay.
I'm so glad that once again, I do thank you for coming on the show and talking about the vaccine, because there has once again been a lot of stigma attached to getting vaccinated, and people have their own personal reasons why they didn't want to. I personally had my own personal reasons, to be honest with you, why I didn't want to do it. So you've definitely convinced me for sure, because it's important. I plan on going to see my mom in Chicago in May or June of this year, and I want to make sure that when I do go up there, that she is safe as well. So thank you for just sharing this information, and I do want to follow up again with you. So maybe about 3 months or 4 months from now, just to kind of see where things are going with the vaccine, and how the population is now dealing with COVID. Just because I know you're in that field, and for me, it's good to do these updates and stuff just to kind of get the information from a medical perspective. So I will be reaching out to you again soon, and just seeing if you have time to just come back on and just give updates and stuff. Because to me, that is very important.
Yeah, great. My pleasure and honor to be with you here today.
Thank you.
Yeah,
Thanks
for inviting me.
You're welcome. And that's it for part 2 of vaccine for this particular show on Mental Health Matters. If you like this particular show, if you like a DVD copy of this show, or if you would like to be a guest on our show, please dial 916-366-4600. Thank you.